Good morning, sir. Thank you so much for coming for this session on Health Forward. We do have Dr. Gyani with us, who is actually labeled as or identified as a person who is like the father of Indian healthcare quality, whose contributions has made us reach or improve healthcare largely, at least for India and in the country. So, sir, thank you so much for being here today. Starting with some of the questions that I have for you to understand a little bit of interesting side of you. So, you have been in healthcare accreditation for a long time, and you were the pioneer for even working on NABH and actually getting implementation of NABH for India. So, sir, if you had to explain what healthcare accreditation is to a 5-year-old child,
Mhm.
how would you do that?
In fact, I do have one of my granddaughter who is exactly 6 years. And
Okay.
yeah, so I remember it, that last year when she had a severe pain. So I took her to the hospital, but without saying accreditation, I told her that I am taking you to a hospital where you will meet doctors as your friends. You will meet nursing sisters, and they have magical power to treat your fever without any pain. So that is the kind of hospital I am taking you. So I think something like that has to be explained to a child, that it is something magical thing I am taking you, where they will treat you without much of the pain. So something like that, I think I would like to explain. Yes.
I think that's interesting, sir, and a very practical example of how you enumerated it. Sir, if you had to design a golden rule for patient safety, what would that be that you want everybody to follow?
You see, I will say, being a person who has been trained in quality since 1993, from my UK days. So I will straightway say that golden rule is work to the system, and system should revolve around the motto do no harm. That is a simple aspect actually which we have been following in our quality journey. Do no harm. That is what we have been teaching to the doctors. But this will come only when you have a system. It cannot be an ad hoc arrangement. The golden rule is work, establish a system which is revolving around a motto do no harm.
Interesting, sir. Thank you so much for that. So, coming to some of the key questions that we would really love to, understand from you and understand based on your experience. As I already said, that you have been a very pivotal figure in NABH since the time it's actually started. So, what were the initial challenges you faced, and how did you kind of overcome these challenges to set the standards for healthcare quality in the country?
You see, you are also have been very integral part of our healthcare journey in our country. In 2005, when reference was made to Quality Council of India, which I was heading, that there is a need to have an accreditation system, largely because medical tourists are asking for it, and that is the
Right,
way
sir.
we started working on this one. And I put a team of 6 very senior doctors to work along with me. And once we were able to bring out the standard in 2006, that was exactly February 2006, we were very enthusiastic. Yeah, this is something new we are launching in our country, and people will run after it. But you imagine a country where there was no regulation. Clinical
Right.
Establishment Act also came in 2011. So where country where there's no regulation, no minimum standard, and then you telling them that you have to establish accreditation system, which is really a kind of optimal level of standards. People were not very keen for it. They say, what is in for us and how it
Right.
is going to impact us. And but somehow I think we had very strong team of these 6 doctors. Now, I told them that we will have to make it success. The only way is because luckily I was also Secretary General Quality Council of India. We had the budget for promotion. So we started doing 1 day awareness program entire country. You will not believe these 5 people and myself in the batches, two each, used to virtually do every week two programs, and major towns, smaller towns. Sometimes, we were so disappointed that people will run away after from our program after half a day one. They say, no, no, this is not for us. this is for corporate hospital, or this is for the Western hospital, developed countries, things like that. Then we sat down with the small nursing home association over the dinner functions. They're also, they're very skeptical, but we persisted. They started then seeing the reason. But let me tell you, at the end of the 1 year from 2006, we hardly get between 35 to 40 applications.
Okay.
And when 1 year passed after that, that came 2007 February, only 5 hospitals could qualify for accreditation. So you can understand that although 37, let us say, hospital applied, but they were unable to really implement this level of standard. So anyway, 5 hospitals were granted accreditation, and luck would have been that this was done by our President of India, Dr. APJ Abdul Kalam, who came in our conclave. I think that really created a push out of it. That, President of India. So that is one big push, let me tell you. Second push came that I realized that our hospitals industry is not prepared. They do not have capacity to understand. So I impaneled 3 consulting organizations officially. I evaluated them, invited them, and 3, and then later it became 4. 4 consulting organizations came. I put their name on my website. I tell you, that created magic, because then hospitals started approaching them that you please help us. And I think, I don't want to name those 4 organizations, but I think they did wonderful work to promote the NABH in our country. And finally, one more thing happened. Maybe 6 or 8 months later on, I was able to convince to the Government of India, Ministry of Health, CGHS, to give push to the accreditation. You are impaneling hospital under CGHS, and you must demand quality. And the only way is that you give some incentive. And they agreed to give 15% more reimbursement to the NABH accredited hospital. I think these 2-3 things really made our journey easy. I think thereafter, of course, we don't have to look back. But I want to tell you, Gaurav, 1 year was very, very laborious, very difficult. Sometimes we used to get disappointed that so much hard work we have done in bringing the standard, getting ISCO approval. But this is the way, we overcame.
Though, sir, you have been very modest in saying to make the journey easy, but we can't even imagine the challenges and the whole struggle that the team would have gone through at that point of time to get this whole envision document into a reality on the ground, and how directly patients benefiting from that. So I would say thank you for doing this, for leading this, because this has really moved our country up in terms of healthcare, definitely. Though there were institutions, organizations before also, they were doing good, many of them, but then I think this gave them a mark to understand their capabilities, which are the areas where they can push more and largely improve more. So thank you so much for sharing that information with us today, sir. Thank you so much for that. During your tenure as the Secretary General of Quality Council of India, you promoted quality in various sectors, including education, environment, public services. How did you kind of approach integrating quality frameworks across these diverse fields?
Yeah, that is a really good question, I will say. You see, when I joined Quality Council of India in 2003, you see, the main task of Quality Council of India was to establish, the national accreditation system for conformity assessment. As the World Trade Organization, they have prescription that each country should have a accreditation system under which the certification body, inspection body, test and calibration laboratory, their results or their reports should be accepted world over. So that is the kind of system we were supposed to create. And the main board for this was NABCB. So my main task initially in 2003 was that how do we establish that and get the multilateral agreement signed with the International Accreditation Forum. So I started doing that 2003, 4, 5, and of course then 6 and 7. All this period was largely, going on that, except that in 2006, as I told you, we created NABH, which actually was not within the purview of Quality Council of India. But it came to me from the Secretary Health and I accepted it, and I think rest is the history. But now coming to your specific question, question, one of the thing, again, I will quote Dr. Abdul Kalam, that when I met him in 2006 to invite him for our conclave, he asked me simple question that you all are doing for industry, now you're doing for health. Tell me who is responsible in this country for quality of the primary education. There is a UGC, there is a technical committee for technical education, AICT, but I have not heard anything about the school. And I told him, sir, even I am not very aware about it. He says, if you want to do something, please go back and work out how do we improve quality of the school education. I tell you, this was really a challenge for me. I gathered 2 3 again experts. You see, Gaurav, you also know me. My style is people give me a lot of credit sometimes, but my good point, or rather I think the strength has been that I gather people like you who actually are really expert, not only expert, but also have aptitude to contribute. And I have been lucky to get people like that. So these 2 3 experts were there, and then I happened to go to USA on some other official assignment, and I met the in the Philadelphia the director of the school education. Understood the framework. I know by this time I am well aware about how the framework is established, because let me tell you, I had 10 years of experience before QCI as a director of Indian Institute of Quality Management. So I think I had that background on quality. So with that, I think I took just 6 months, created the standard on school accreditation, went to the Dr. Mr. Arjun Singh was the education minister, handed over to him, and he passed on to CBSC. And CBSC adopted that standard, though I think they should have given a lot of credit to QCI that time. But anyway, they adopted it. So that is the way it came. Second was, of course, the public services. Very, very interesting. So there was one gentleman, I am not remembering his name now, from the PM's office, that he said there should be something, how do you apply ISO 9000 into the public services? So again, I think with little bit of effort, we created a guideline. Because if you give ISO 9000 to the Ministry of Commerce, they say what the hell it is, it's not applicable to us. So we had to tailor it. And I think that again worked. And I think that criteria, a lot of ministry also went for ISO 9000 based on those guidelines. And similarly was the case, for the environmental impact assessment. So I think all in all, I can give the background. My background of 10 years of IIQM really helped me. And remaining, of course, again and again, I'm telling you, my way of doing is get 4 5 good people from the market, get them associated, empower them, give them the importance and rather authority to make them part of the QCI. And it really worked.
I'm sure, sir. I think you actually, I think, had thought through all the steps of what's gonna work. Though I'm sure that there were challenges as we discussed earlier, but I think planning is very critical. And what I'm hearing from you, because there are a few things which I'm listening from you for the first time, to be very frank, though I'm associated with you for so many years, but it definitely talks a lot about your planning, rather strategic planning, on how can we make sure that whatever we are up to, it is a success. So I think hats off to you for doing that, sir. Sir, you have also been on board for ISQA for a period of time. What are the key insights did you gain about global accreditation practices, and how have they actually influenced the work that you largely did in the accreditation sector in India?
You're right, actually. I think we were privileged, I will say, that right in the initial stage, I got elected on the board of ISQA, because India was really a beginner, I will say. But I don't know, somehow we were able to make impact, and I got elected by various countries who were on the membership of the ISQA. If you really ask me, I attended all these meetings which they used to hold in different countries. I only used to look at how actually are they implementing those accreditation body, So, for example, ISQA meeting is held, let us say, in Jordan. So I'll try to see in Jordan how actually the implementation is taking place, how do they promote, how do they select their assessor. For example, when I went to Canada, I got, they had 18 full-time assessors sitting in the secretariat. In Australia, something different was there. They had impaneled assessor, but not full time. But they were told that you will be our principal assessor in all the assessment. So that means I could see there was a continuity by way of those principal assessor who are on their panel. That means they were being paid minimum some remuneration. So in India, what I used, developed the model was based on the Joint Commission, which of course Apollo has been the, I tell you, Apollo also I want to give credit from this point of view, because really they started with Joint Commission, but later on, I think they were the important promoter of the NABH entirely, top leadership of the Apollo. So I found in Joint Commission, they used to have team of clinician, administrator, and a nurse. In my own country, initial days, there was a lot of opposition by some of the people that we should not bring nurse as an assessor, because in our country, their status or esteem level still is not at par. But somehow, I don't know, my inner hunch came that no, we will start with the model which Joint Commission follows. And we had the same model. And let me tell you, I think today I can tell you our nurses, maybe because of the NABH, this kind of thing, many nurses today are occupying the position of COO and even CEO of the major hospital. So I am not saying that it was because of my initiative, but really it helped in bringing the esteem level of nurses. So this is what I used to focus whenever I used to participate in the meeting of ESQA.
Great, sir. I think these small things really make a lot of difference and
Yes.
may not be a direct impact that you can actually measure and see, but then you can feel it. You can attribute
Yeah.
something to that they are there.
Yeah.
And as rightly given the example by you, especially on the nursing, I think I personally feel that they are actually the backbone of healthcare. Nurses spend most of the time with patients, so all your thing about whether you are a good hospital, whether your outcomes are good or not, largely depend on the nursing care. And nurse is the one which the patient sees most of the time. So you are completely right. And I think what you said and what you did really did make an impact on taking them to the boardroom level and giving them a seat which is due for the work that they do and the respect that we should be giving them. So thank you for sharing that as well, sir. My next question is, looking ahead now, as in the future, what are the emerging trends or innovations do you believe will have the most significant impact on patient safety and healthcare quality in India?
You see, sometimes I quote that at the time of independence, we had the average life expectancy around 37 years. Many people do not believe when I say this one. It was only 37 years, 1947. And today, is it exactly about 73 years? Now, you see, people, when they question sometimes, the cost of corporate hospital is too high, or, they really, I give them this simple answer that how it has happened. It has happened only because the advancement in the way we deliver the healthcare. Technology is the one of the major factor. Our doctors' qualification is the major factor. Our hospital system, accreditation, everything is playing role in improving the patient safety. Now, coming to, in fact, one of my meeting in the Niti Aayog, I did mention that if you are talking of reforms in the healthcare in our country, there are two things important. One is it starts from reforms in the medical education. How do we really build the competency, skill in our doctor, nurses, and allied health? Second is, let us not forget the diagnostics. Actually, diagnostic is the starting of delivering of the healthcare. Diagnostic is the one from where exactly the physician or the surgeon get the guidance. That is the starting point. And I think the question is that if you focus on technology and improve the diagnostic, which is now happening now. Artificial intelligence, the way it is eroding, clinical decision support systems are coming in a big way. So I think we have to focus more and more on improving the diagnostics. And diagnostic equipment, by and large, still, I think more than 70% of it, A and B category, are being imported. So we have to see that how do we reduce the custom duty on that. Secondly, how do we indigenization drive? We give a thrust to it. So if these two things we do it, we will be able to improve the quality and patient safety more so when availability in our country and accessibility in country still is very low. In fact, we submitted a report to the government that we have hardly 1.5 or 1.6 beds per thousand population in the entire country, as against the requirement of 3.5 by the WHO. So if technology is there, I think we will be able to overcome this deficiency to the great extent. And finally, I will say that our hospital system, through the accreditation, are becoming more and more patient centric. So we have to emphasize on again and again saying medical education, bringing technology, and improving the patient centricity through again smart hospitals. Because medical technology and information technologies are the two aspects. Information technology, when I am talking of the HIS. That if you improve the HIS, then the efficiency and effectiveness of our system will improve. So by putting these four things together, we will be able to see. And in fact, I quote your good friend Anupam. He came in our conclave, in one of the conclave, and he says India as a Vishwaguru in 1947. So in fact, that I took it as a caption in our conclave. So in short, we can do it. 2047 is still far, but the kind of expertise we have, we can become the Vishwaguru in healthcare in 2047.
I'm sure, sir. Thank you so much again for sharing that, sir. The last question for the day today. You have been a very integral part of International Patient Safety Conference since the time we started, and thank you for that once again for being a part of it. We have this 2025 edition coming up. What excites you the most about it? And how do you see a conference of this kind actually influencing the future of healthcare quality and patient safety?
Yeah, actually, I have been part of it right from the first conference. In between, one I missed last time because of some other thing. You see, the main reason is that you have been able to bring the experts from the globe. I think that nobody has been able to do it, number one. Number two, your presentation and your deliberations are based on the real case studies. Because nowadays there is a PPT culture that people can make PPT from ChatGPT here and there, and then somehow come and they are good speaker, they can speak. But actually, you do not gain from anything out of it unless the people are making presentation based on the data. And I want to give credit to Apollo, for example, as a group. When I used to be in the QCI, I think the kind of clinical indicators you used to bring out among all your hospitals, and they used to be compiled, shared, do the benchmarking. I have no hesitation to say that Apollo has been the leading player in this aspect. Now one or two more chains have started doing this. So IPSC actually brings out all these things on ground, and that is why they add hell of a lot of value to the delegates. So I think in that respect, the patient safety per se, it is actually visible in the conferences which you are holding. So I am really looking forward, and I'm sure everybody will be excited to when they really participate and listen to this kind of deliberation based on the ground realities. All the best to you.
Thank you so much, sir. We really look forward to having you at the conference and also listening to you much more about your experiences. So thank you so much once again for your time today and see you soon, sir. Thank you.
Thank you very much. Great, Gaurav. Thank you.